a topic known as measles. Maybe a lot of people don't even know about it, but if that's the case, don't be worried, because today we are going to be dissecting the topic. We'll tell you what you need to know about it, and also how you can better prevent this disease. The measles outbreak response vaccination campaign began yesterday across 5 regions of Cameroon. The campaign targets children aged between 9 months to 9 years old and aims to curb the outbreak of the disease. On tonight's edition, or today's edition, we'll be looking at what measles is all about and how we can better curb the disease, as I earlier said. But before introducing our guest for the day, let's welcome my co-host, Ese Lucy Liengu. Hello, Lucy. It's a pleasure to have you on the program today.
Hello, Immaculate. It's always a pleasure, and good afternoon to all our listeners and viewers out there.
As I rightly said, our guest is already seated, and our guest for the day is Léonard Ewane. He is the regional coordinator for the expanded program on immunizations in the Lithra region. It's a pleasure to have you on the program.
Good morning, good afternoon, Immaculate.
Good afternoon.
It's a pleasure.
Today we are talking about measles, and a vaccination campaign was recently launched. That was yesterday. Before coming to that vaccination campaign and why it was launched, we want to know what's measles all about.
Immaculate, measles is a viral contagious disease that can affect everybody, but mostly affects children under 5. And this disease is manifested by major symptoms. And the major symptoms, you have high fever, and you also have skin rash, what we call maculopapular rash. And then this can also be accompanied by minor signs like cough, and then like catarrh, or you have red eyes, that's conjunctivitis. And it should be known that this disease is transmitted through sneezing or coughing. What does that mean? It means that when you cough or you sneeze, somebody who is sick, the tiny droplets in the air that contain the virus, once these tiny droplets are inhaled by somebody who is by your side, that person will get infected. That's how the disease is being transmitted.
Then now, why is it that as children are more susceptible to contacting this disease?
Yeah, why children? You realize that children, they are still at a tender age, and they have not developed, their immune system is still very weak. They have not yet developed a strong immune system. That's why children are susceptible to or are exposed to most diseases.
Okay.
All right. So, doctor, let's come back to some of the symptoms of this health condition.
Yeah, as I said, Lucy, the main symptoms, you have high fever. When I talk about high fever, that's fever that is above 38 degrees centigrade. You also have skin rash, what they call maculopapular rash. And this can be accompanied by minor signs. The minor signs may be cough, maybe conjunctivitis, that you have the red eyes, that also contain tears. And then you also have, you can also have a running nose, what we call catarrh. Those are the symptoms. But then, measles as a disease, most viral diseases do not have a cure. So measles does not have any cure. And that's why we lay more emphasis on the preventive method. And the most preventive method here is vaccination. It should also be understood that measles may lead to some complications. Which are the complications? You may, as soon as you have those signs that I have just cited, once the virus gets to the brain, the virus will lead to the inflammation of the brain, and that's what we call encephalitis. Also, the virus may get at the level of the lungs, and when the virus gets at the level of the lungs, you have what they call pneumonia. And you see that it can also get to maybe diarrhea. It can also lead to an impaired vision, or a serious infection of the eyes or of the ears. And that's why when those complications settle, it will be difficult for the child to restore, for the health to be restored. And at that level, it may lead to death. That's why today we lay more emphasis on the preventive methods. And the most effective preventive method is vaccination.
All right, doctor, before we talk about the vaccination campaign which is ongoing, we'd like to give out numbers for those who like to participate on today's health program. We have 670-54-7049, 670-54-7049, or 656-62-2222, 656-62-2222, and we have the contacts on our screen. Now back to you, doctor. We have the immunization vaccination campaign. There's a response vaccination campaign against measles in 5 regions of the country across 9 health districts. We want to understand what was the objective of this campaign.
Yeah, what is the objective? Lucy, it's important to know that at the end of 2024, so the Central Coordination of the Expanded Program of Immunization, that's in Yaoundé, carried out what we call an in-depth analysis of the performances. And that in-depth analysis showed that there were gaps in terms of epidemiological surveillance of measles, as well as in terms of routine immunization, that's coverage. So if you can remember, the last campaign that we had, I mean, they call it the follow-up campaign, was in 2023. But since then, we had cases that dropped. But since last year, we started having more cases. And why do we have more confirmed cases? Is because the vaccination coverage for the first dose of the vaccine against measles and rubella stands at below 80. That is at the level of the littoral. At the level of the country, it just oscillates around 80%. So this vaccination coverage for the first dose was not sufficient. Also, we introduced the second dose of the vaccine against measles and rubella. That was in the last quarter of 2020. Since that second dose was introduced, it has not yet gotten to an optimal coverage. It means up to now we still have a coverage that is below 80. So when you take into consideration the gaps that we had in terms of surveillance, you take into consideration the coverage of the first dose of the vaccine against measles and rubella, you take into consideration the second dose that is given as from 15 months of that same vaccine. You see that all those conditions is what the central level in collaboration with partners put together, and then we are able to do what we call a risk analysis to know exactly that there are clusters of cases in some specific regions. That's why when we talk of the campaign, we don't talk about the entire country, but we talk about specific regions and specific health districts. So as you rightly said, the main objective of the campaign is to make sure that we vaccinate all the children aged 9 months to 9 years. We should be able to give them the vaccine against measles and rubella. You know, for some that will be vaccinating for the first time, will be getting the first dose of the vaccine. But for some that must have gotten the vaccine before, we'll be giving them the second dose. And studies have proven that once a child has taken both doses, that's the first dose at 9 months and the second dose as from 15 months, that child is fully protected. So that's the main reason for this campaign. And the campaign is a response campaign. It's important to mention that the campaign that we carried out in 2023 was just a follow-up campaign. Follow-up campaign, why? Because measles is a cyclic disease. What does that mean? It means that every 3 years, we have cases that will come up at the level of the community. Why? Because it's not everybody who will be able to get the vaccine. So we organize campaigns to be able to supplement, to be able to complement what we could not achieve during routine. So when we carried out that follow-up campaign in 2023, we realized that cases were coming up. But the cases that came up, there was what we call emergency funds that was put at the disposal of the Central Coordination Committee of EPI. So those funds were there to be able to carry out what we call local responses. As soon as you are declared in measles epidemic, what do? You need to carry out an in-depth investigation. You should stop collecting measles, what we call biological samples, where measles can easily be detected at the level of the lab. So you don't collect samples again. You carry out an in-depth investigation, and from that investigation, you will know exactly where the cases are found. You'll be able to spot those cases That's what we call the mapping of cases. And from there, you will develop what we call a local operational plan. And from that plan, you will know exactly what is the extension of your local response. So that was being carried out in every district that was declared a measles epidemic. But then we realized that some of those declarations came late. It means cases were confirmed, but when the health districts were supposed to carry out investigations, some of those investigations were done a little bit late. And then the response was not optimal. So when you combine all of that, you discover that there's a gap in immunity at the level of the population. That's why the Ministry of Public Health, through EPI in collaboration with partners, has decided to organize this response campaign to respond in those health districts that are at a very high risk for the meantime.
Now, Doctor, you have chosen 5 regions out of the 10 regions in Cameroon, and we all know that humans are mobile.
Yeah.
Measles can move, as you said, it's transmitted.
It's
Someone can
contagious.
leave from Douala to Bamenda or maybe to the southwest region. And despite the fact that measles wasn't detected in that part of the country, this person may have brought it there. Why just limit yourself to these 5 regions, whereas we know humans are mobile?
Yeah, Immaculate, I think if you must have understood me, what I said was that the campaign that is being carried out now is coming as a supplementary intervention. So there's already a mechanism in place. So much that when there's a district that is declared a measles outbreak or epidemic, there's a local response that is being carried out. So that work has been done. Then now the question, to answer the question that you just asked. So you see that if somebody lives in an area that may be considered as high risk and goes to another area where this immunization campaign is not going on, the campaign is not going on, but we have routine vaccination in those areas. It means that that person can easily be captured. You know, in our routine vaccination, we do it at the level of the health facilities, that what we call fixed posts. We also have the outreach. That is done routinely, I mean, on a daily basis. But another thing that I want to emphasize on is that once the child has been fully vaccinated, has taken the first and the second dose, even if that child carries the infection, the child is not highly susceptible to transmit that infection to another person. So we can say that for somebody who is fully vaccinated, even if you get in contact with the germ, you will not be able to develop the disease. So that's what I can say for now. And the five regions concerned, as you rightly said, you have the center, you have the east, you have the littoral, you have the north, and you have the southwest. So, and we have just 9 health districts, so that are considered at high risk. Why are these districts considered high risk? Immaculate, I mentioned earlier about the investigations. During the investigations, our findings revealed that children who contacted measles, that's the confirmed cases, were beyond 5. You know, when we vaccinate in routine, we vaccinate from 9 months to 5 years. That's what we do in routine, because we do the catch-up. But then we realized that children who got the measles were beyond that age group. And those children are mostly located in those health districts. At the level of the littoral, we have 3. We have Logbaba, we have Cité de Palmiers, and then we also have Yabassi. I think Yaoundé also has, the center also has 3. Then we have 1 at the level of the East region, 1 at the level of the North region, and 1 in the Southwest. So that's why those diseases are considered at high risk, and that's where the intervention is being carried out. And we carry out the intervention so that we should be able to curb the transmission links, so that the disease should not spread further.
Looking at all the cases that were recorded, was there any case of an adult?
For now, we've had cases that were beyond 9 years, but those cases were very few. So for adults, adults must have had an immune system that is so robust, that have been built up over time. So they may not necessarily, even if they get in contact with the virus, they may not manifest the signs and symptoms. So that's why with adults, our intervention does not target the adults. So we target mostly children, and that's the most vulnerable age group.
So there's a possibility for an adult to receive the vaccine, he should refuse?
Now, what is happening is that, we can't give the vaccine to adults. When we talk about EPI, EPI is the expanded program on immunization. So the vaccines that the country acquires in the EPI program, those vaccines are free of charge. And once the vaccines are free of charge, we don't give the vaccine to any person. We give the vaccine to the appropriate target. And when you look at the calendar for the administration of the vaccine against measles and rubella, you will understand that that calendar is made of 2 doses. It means for that vaccine, the child is supposed to take 2 doses. I think I mentioned 9 months and 15 months. But Immaculate is very important to mention that when the EPI started as a pilot project in 1976, we had just 4 vaccines. And I think the 4 vaccines were the vaccine against tuberculosis, that's the BCG. We had the vaccine against diphtheria, against tetanus, and against whooping cough, what we call DT cock in those days. And then we also had the vaccine, the oral polio vaccine, and the measles containing vaccine, that's the vaccine against measles. You must have heard that the campaign we have presently, the vaccine we are using to respond is called the measles rubella vaccine. It means that vaccine prevents 2 diseases, but we did not have that at the beginning. So you see that around 2015, we realized that there was also a problem with rubella, which has similar symptoms like measles. That's why in 2015, the vaccine against measles was combined with rubella, taking it as a single vaccine. So today, if we are using a vaccine against measles, the same vaccine will protect against measles, and it will also protect against rubella. So since 2015. If you permit me, people get the vaccine during their childhood, and that's why we have the vaccination calendar. Okay. Immaculate, you bear with me, you and Lucy. You put our communication icons today because your parents did their job. They gave you all the essential vaccines during your childhood. That's why you grew up strong and you are able to serve the nation. So vaccination is very important, and that's why we keep on laying a lot of emphasis that people should ensure that their children get vaccinated. And as far as measles is concerned, the 2 doses are important.
All right, doctor. We also know that when we were talking about vaccines, parents or Cameroonians are scared of vaccines because of maybe the side effects. So how sure are we that when we vaccinate our children are going to be safe, they won't have the after effects later on?
Yeah, I'll begin by saying, Lucy, that the vaccine against rubella and measles is a vaccine that is safe, it's a vaccine that is effective, it's a vaccine that is free. But then, as any other vaccine or any other drug, you see that when you take the vaccine, you may develop side effects. But from the mechanism that the country has put in place to be able to capture information on those side effects, we discover that those side effects are very rare. And even if they do, and when they occur, only minor cases are being sent forward as information to the upper management. So we have been recording only minor cases. And why do I say minor cases? Because it's an injectable vaccine. So when a child is being injected, that area will pain. That area may be reddish. The child may develop mild fever. So those are minor symptoms that will subside in 1 or 2 days. That's why we call them minor. But severe cases, they are very rare. But then, if they do occur, we have a mechanism in place at the level of all the health facilities, so much that when a child comes to the hospital after the child must have taken the vaccine, there's already appropriate care, optimal care that will be given to that child. You know that some of those diseases, we don't have a specific treatment against those diseases. That's why we lay emphasis on vaccination. And when the side effects do occur, we'll always take care of that.
Okay. So what should a parent do at home when he or she realizes that the child is facing the side effects?
When the child is facing the side effects, for the parents will always go to the nearest health facility. You know, parents are not medical personnel, so we cannot tell parents to do A or B. So I think the appropriate solution is found at the level of the health facilities. That's why, in case of any side effect, always get in touch with the nearest health facility. And also what we have done, Lucy and Immaculate, is that, you know, people who vaccinate at the level of health facilities, they have already formed what we call it's just a family. So
we have a call on the line. We'll come back to you. Hello.
Yeah.
Good afternoon, Madam.
Good afternoon, sir.
Yes,
This is
sir.
Nyam Christopher Bole Bakundu.
Okay, sir, your question.
Yes. You people are talking about sex. I want to know what is really a side effect when it comes to treatment.
When it comes to the treatment
So when it comes
of
to
vaccines.
what is really a side effect when it comes to your treatment? It is then they talk about side effect. What does that mean? Is it overdose or what?
Okay, he wants to understand the definition of side effect.
Exactly. Can I answer? I think I can answer
Yeah.
directly. So thank you for that caller. Now, concerning the side effects, it means that, like you rightly said, so if the child develops maybe severe high fever or whatsoever, or we find out that the child is irritated, the child cries all throughout, once that child gets to the health facility, what we'll do is that the child will be consulted. We'll be able to examine the child. The child will be examined by a clinician. So any ailment that will be found at the level of the child, we'll make sure that that ailment is being taken care of. So what we are treating at the level of side effects are the signs and symptoms. You know, I earlier mentioned that there's no specific cure. There's no specific cure for measles. So what we'll do is that once the child comes at the level of the hospital with the side effects, so the clinicians will make sure that those side effects are being handled. If a child comes up with fever, they will give a treatment that will target the fever. If the child comes maybe with the area where the injection
We
was
have another call on the
yeah.
line. We'll come back to you. Hello.
Hello?
Yes, sir. Good afternoon. Your name and where you're calling us from.
Yes, I'm Mr. Ken calling from Yaoundé.
Thank you and welcome. Your question.
Yes, but we have been hearing some certain stories about vaccination getting into relation with autistic children. I don't know. I just want the doctor to clarify us and tell us if those side effects, autistic children, are they having those symptoms? Are they having it from those vaccinations? Because there are people talking about that. It is caused by vaccinations. I don't know if it is true or it's false. Or that's what I just wanted to know. Because it makes us feel so, we are afraid sometimes.
Okay, like
About vaccination.
okay,
Wait,
thank
you
you so
understood the
much for the
question?
question.
Okay.
Yeah, he is trying to find out that can vaccination lead to or can cause a child
To
be
be
autistic.
Autism.
No. That we have not recorded yet. And I think, as I earlier said, the vaccine against measles and rubella is as far back as maybe the onset of the program in Cameroon.
Okay.
If you look at it, you look at it at the level of the world, it's a vaccine that is being used in almost all the countries.
Thank
we don't
you
have a
so
specific vaccine. But then, Immaculate, if you permit me,
Time is already against us. Our technician is already telling me that it's over. Less than 30 seconds.
Okay. Thank you very much. I think Immaculate, maybe take home message.
Yeah.
We should be able to tell parents that parents should reserve, maybe should welcome teams at the level of their households, because the social mobilizers will go from one household to another to be able to sensitize, and that the campaign will run from yesterday when we began the campaign to the 17th.
Thank you so much.
And the target age group here is 9 months to 9 years.
Thank you so much. It's a pleasure to have you on the program. Equally, big thanks to you, Lucy.
Always a pleasure.
A big thanks to Luipego and also to Jonathan Biabula, who were behind the scenes to give us what you're seeing right there on your screens and also on your radio set. And we had as guest Dr. Léonard Ewane, Regional Coordinator for the expanded program on immunization in the Littoral region. And that's what put a cap to today's edition of the program You're in the Health on Equinoxe Radio Multimedia. Thank you so much for your time and have a great day in the company of more interesting programs on Equinoxe Radio and, of course, television. Bye-bye for now.